For my presentation, I've chosen to do antisocial personality disorder. This disorder is a personality disorder that is defined as the pattern of socially irresponsible, exploitative, and guiltless behavior. This disorder usually begins in early childhood, usually around the age of 8, but cannot be diagnosed until the age of 18. This being because um, when a child is at this age, they believe that children's brains have not been fully grown. They're not done growing until the age of 18. So they aren't diagnosed with this until the age of 18 when they believe their mind is done growing. So they just diagnose it as a conduct disorder. The history of this disorder, antisocial disorder was not recognized in the DSM as antisocial personality disorder. It was previously labeled under the category of psychopathy or sociopathy. It wasn't until the 1980s that they accepted it into the DSM and gave it the term antisocial personality disorder. They realized there was a difference between psychopathy and sociopathy. Psychopathy has no empathy for others or anything, whereas sociopathy is little empathy and have a conscience. So when an antisocial personality disorder person does something, such as hurt other children, siblings, other people, small animals, manipulate others, they don't feel bad for it and they don't see anything they're doing as wrong. Those with sociopathy disorders, they have empathy and they do have a conscience of what they're doing. Those with the antisocial personality disorder are definitely more along the lines of psychopathy. They have no remorse for others and they're very, very shallow. The advancement of technology and medicine has helped researchers learn more about this disorder and its traits. Before the 80s, when they started learning more about the antisocial personality disorder, they had no idea what it was. They had no background on it until they started checking into it more and distinguished the difference that it wasn't psychopathy and it wasn't sociopathy. The prevalence of this disorder means it's what is the commonness of this disorder. The prevalence isn't very common. The lifetime prevalence I found is 2% to 4% in men and 0.5% to 1% in women. It says that the prevalence peaks in people aged of 24 to 44 years, and it drops off between ages of 45 to 64. And then depending on the setting in correctional facilities, the prevalence reaches up to 80%. You'll find this disorder to be more prevalent in correctional facilities and prisons and jails because those with antisocial personality disorder are the people who do not obey laws. They have aggression problems. They can be serial killers. They are dishonest. They can't keep a job. So that's why it's more common to see this in correctional facilities than just every day. Here is a chart showing the antisocial personality disorder by age and sex. You'll see here that between the ages of 18 to 34, the dark blue is the men, and then it's at 1.7%. Whereas the women between 18 and 34, it's only at 0.4. And then as the ages drop off, you see the numbers starting to get lower. So as I said, in the prevalence, it peaks around the age of 24 and starts to drop around the age of 44. So right here, you're going to see you're dropping after the age of about 40. Symptoms of an antisocial is they're very distinct. You know the symptoms of an antisocial. So one that has this disorder has a problem seeing the wrong in what they're doing. And like I said, they have no empathy for others whatsoever. They're very shallow. They use people to manipulate them for their own benefit, to get money, to gain some kind of personal rewards. They don't have close relationships other than if they're just trying to manipulate them. This also goes back to a young age of having no friendships. They don't even have a close family bond. They don't obey laws. They're consistently irresponsible. And a number one antisocial personality trait is they're very charming. They know how to get to people, they know how to manipulate them a certain way and to just come off as a very charming, wonderful, loving person. And people with antisocial have aggression problems. So when they're charming and their deceitfulness isn't working and you're starting to figure it out, such as therapists, and they confront them, they get very upset and very aggressive easily. Treatments for antisocial personality disorders are not easy. Those that come to seek therapy do not usually come because they know that they have their personality disorder. They usually go to therapy because they're sent by a hospital or a jail because they've done something wrong and they need to go, or they're having drug and alcohol abuse or marital problems. This isn't a successful thing because if they do not want to change and don't have intentions of changing, they're not going to get help. Cognitive therapy is one of the few treatments that can somewhat help, but not necessarily cure. Cognitive therapy is where the therapist gets the patient to think about what they're feeling, what they're doing. And with antisocials, this is hard because they cannot think about what they're doing because what they're doing in their mind is not wrong. There aren't really any medications that have been found to help treat antisocial personality disorder, but with their aggression problems, they can be treated that to help lower it. The controversies in antisocial disorders is whether when somebody gets in trouble, the court is brought up to the problem of whether they did this because of their disorder or if they did just to do it. So they don't know whether to hospitalize them or punish them in a prison. As you can see in the little cartoon, it says, "How am I supposed to know whether I'm innocent or not? I'm a sociopath." And then a bonus slide is two very familiar faces of antisocial personality disorder is Ted Bundy over here and Jeffrey Dahmer over here. Both of these two men had the anti-personality disorder. They are very famous serial killers. Ted Bundy is also known to be very, very charming. As you can see in this picture here, as he's in court, you can just look at his face and tell that he's a very charming individual. He knows how to work people. He knows how to manipulate them. And this is how he did his murders and his serial killing. Same with Jeffrey Dahmer. He approached single men that had problems with their marriages, and he was very manipulative with that way. They were vulnerable, and he slipped in, and he knew how to manipulate people, and he was charming. And then this is my reference page.